All right, good morning everybody. I'm Dr. Pradeep from Escott Family Dental. And what I'm going to talk today about is halitosis.
Oh.
Bad breath. Yes.
What are you trying to say?
One of my patients came to me, it's about 2-3 years back, and he's like, my son has the worst case of dragon mouth.
Like what?
Dragon mouth. I'm like, what's that? He has such a bad breath. And I'm like, I like that name, dragon mouth. Yeah. So, but then I searched it up, and there is a word that's popular in dental communities called dragon breath or halitosis. So we're going to talk about halitosis. Now, everybody at some point in their life has bad breath. There's no doubt about it. As a matter of fact, there was research done about it, and the research says that more than 50% of adults at some point in time, they have bad breath. So if you feel that, hey, if you have had a bad breath at some point in the past, you're not alone. Okay. So let's talk about what causes bad breath and what can be done about it, right? So first, and the most common thing that causes bad breath is bacteria. Okay. So as probably all of you guys know, in our mouth there are good bacteria, bad bacteria, there's all kinds of bacteria. When we eat food, this food basically, we swallow it, but remnants of this food, they stay on the top of the tongue. And the bacteria react with this food and brings out some sulfur compounds, and those sulfur compounds is the bad breath that we smell typically. So that, so the bad breath usually that most of us encounter is the result of the bacteria that are on top of the tongue. Okay. So that's one of the most common reasons. The second most common reason for the bad breath is dry mouth. Lot of patients, a lot of people are getting older. Our average lifespan is getting longer than usual, longer than before. I think right now the average lifespan for a healthy man at the end of 60, if you're 60 years old, you're healthy, you're going to live until 87 years old.
Wow.
And if you are a female who is healthy at the time you're 60, then you're going to probably live 92 or 93 years old. So, we are staying longer than what we used to live. So what it means is we're probably going to at some point get into have some kind of medicines that we're going to take. And all these medicines, when we take it, has some side effects. And most common side effect of the medicines is dry mouth. And these dry mouth, what it does is, saliva is an amazing thing. It washes out the plaque out of our mouth. But if we don't have any saliva or very little saliva, then our mouth stays dry. And mouth stays dry, plaque gets accumulated, and the same thing happens. The bacteria react with all the food that we eat, and it produces the bad breath. The same thing happens. The third most common reason is gum disease or periodontitis. If you are having gum disease, basically you are having infection in the mouth. I read some analogy that somebody was giving, and they say that, hey, if we have a sore in our body the size of our arm, we would probably be running to emergency if we have a kind of a wound that is as big as a sore, as big as our palm. We would be running to emergency. However, people don't know that when you have periodontitis or gum disease, you are actually having a wound that is the size of our fist if we calculate all the area. Because when we bleed, when we are brushing, we don't take it seriously, right? When we start bleeding in our hand or in our foot, we take it seriously. Why don't we take it seriously when we start bleeding from our mouth? So that's what gum disease is. People don't take it seriously because it does not hurt, right? But gum disease is bad breath causing. What gum disease is basically, it's a pool of bacteria that's sitting in there producing toxins that produces abscess that leads to bad breath. So that's the third reason. Now, next two reasons are pretty common, we all know. Smoking and food. You know, we all know smoking is going to cause bad breath. We all know that certain food, garlic, onion is going to cause bad breath, right? So those are the other two common reasons. So if we have ruled out all five and if still somebody has bad breath, then it basically means that there's something in the body medical. You have to see your doctor because there are certain diseases related to liver, your kidney, your tonsils. You know, those all can cause infection, and then they all can cause bad breath coming out of our mouth. Okay? So those are the six common things that causes bad breath. Now let's jump into our plan of action. So what are we going to do for the bad breath? First thing we talked about is bacteria, right? So what are we going to do about that? Like I said, we can use mouthwash, but it's just a temporary patchwork kind of a thing. You know, mouthwash can only work for an hour or so, right? We obviously recommend brushing 2 times a day, flossing once a day. However, like I said, bad breath producing bacteria are not on the teeth, they are on the tongue. So you need to get your tongues clean. You can go ahead and just get a toothbrush and scrape your tongue. Or if you go to market, Walgreens, pretty much all pharmacy around, they carry something that is called tongue scraper. So make sure you buy that tongue scraper and make it a routine of your brushing. You know, brush, floss, scrape. You know, so make it a routine. Scrape your tongue. It's very important because that's what's causing the bad bacteria. That's what I told that father who was concerned about dragon breath from his son. That he's probably not cleaning his tongue. That's where most of the bad breath is coming from. Okay. So make sure you use tongue scraper. Scrape the tongue. Get the bad breath out of your out of the mouth. Okay. Make it a routine, and it's a pretty inexpensive thing. You can buy it from Walgreens or any of these pharmacies, but you get a pack of 2 or 3 for $5 or something like that. The second thing is dry mouth. So what are we going to do about dry mouth? I mean, you have just to be aware. Number one, that you're having dry mouth that's causing bad breath. And what can be done about dry mouth is there are a lot of sugar-free chewing gums. If you start using the sugar-free chewing gums, it's going to artificially produce saliva. You can drink a lot of water. You know, that's the easy one to keep your mouth moist. There are certain dry mouth mouthwash available called like this Biotene. You can use Biotene. It is supposedly said that you can get extra mouth moist with Biotene. So those are the 3 things, and just make sure you have to visit your dentist. You know, sometimes dry mouth is not only one of the leading cause of bad breath, but dry mouth is a leading cause for cavities in a lot of adults. You know, who are taking all this medicine. You know, you suddenly just the other day I had a patient. You know, within a couple of years he has dramatic amount of cavities. I'm like, what changed? He's like, I don't know, nothing changed. I'm still brushing the way I used to do because everything is same. But then he told me that I got diagnosed with blood pressure, and then doctor has put me a whole bunch of medicine. That's the only one thing that happened. And he's like, yes, I have dry mouth now. So dry mouth is the leading cause of all the cavities. So the third thing we talked about is gum disease. So again, for the gum disease, you have to you need to get deep cleaning done when it is necessary. You need to see your dentist 2 times a year. And if you're having gum disease, we recommend for at least for 1 or 2 years while you are going through the treatment, instead of 2 times a year, maybe see the dentist 4 times a year. Once you're back to normal, then you can go back to 2 times a year. But sometimes you have to see the dentist 4 times a year. Okay. One of the other things that elderly patients have noticed is, they wear these partials, removable denture and partials, and those are very notorious in harboring plaque. So not only you need to brush your teeth and clean your tongue and scrape your tongue and all of that, but you need to make sure you clean the dentures every night. If you know if anybody's wearing denture or you wear a denture or partial, make sure you take it out, keep it clean, and leave it outside. The dentures you're not supposed to wear the denture all night. Your mouth needs breathing space, so take it outside. Take it outside at night. So that's the third thing we talked about. Obviously, smoking, we all know that doesn't help anybody. So you need to quit. The fifth thing is and the fifth thing is onion and garlic. You know when you're taking it, you just to be step away from everybody else. Right. So, and the last and not the least is if, like I said, if none of these are the reasons and you still have bad breath, then you need to definitely check with your physician to make sure that, hey, you know what, there's something else is going on, probably something serious. If anybody has any questions about what I just talked about, I'm here to get the answers. But I also got this presentation from American Dental Association website, so if you have any questions, you can always go on ADA's website for more information. I'm open for questions.
Very good.
What is, when you say dry mouth, like, I feel like I have a saliva and everything, but is it really completely just dry?
Oh, it's dry.
You'll know if you have it.
Yeah, it's dry because I see mouths every day, right? So I can tell looking at the mouth that it's a dry mouth. It's dramatic. It's dramatic.
Wow.
Yeah.
It's not a question, just a appreciation for Dr. Parikh, and it actually has to do with dry mouth. And it's my mom had told me that all of a sudden, she didn't tell me things till it's way past being too late, but that because of dry mouth, because she's always had really good teeth and everything, that many of her teeth are now like where they're going to have to be pulled, and the doctor or the dentist she's seeing, the estimate might be $30,000 worth of work, and so Dr. Parikh, and thank you very much, he's looking at what the estimate was, and also possibly, she doesn't live close by, but maybe one day I'll just bring her up here to see what might be another option for her. But going back to what he's saying, the dry mouth, I didn't really know much about it myself, and you can go from having very good teeth to within a couple of years after I talked to her, yeah, it's been a couple years or so. I'm like, Mom, you should have told me, but anyway, so do take it seriously. That's all.
Definitely. Wow.
All right.
Thank you
so
very
much.
much.